this is Smita Kumar, and you're watching Medicircle. And today, on our healthcare startup series, we have one more very interesting entrepreneur with us. That's Sandeep Bhatia. And Sandeep is a serial entrepreneur who has founded HELO Health. So he has gained experience by spending 25 years in renowned organizations like Canon, Forbes, and Philips. He has expertise in building teams and businesses from scratch to scale. He's now using his skills in the healthcare space. And what better next time? I mean, what next? That's next time to be here in healthcare, because healthcare is already brimming with so many good startups, innovations, and some such startups which are actually solving such problems not only in the tier 2 or metro cities but also in the remote populations of India. And that's the way we should be bringing India, empowered India and a resilient India. So here's to more such startups. This series has been planned in such a way that we talk to the entrepreneurs and try to know more about them and how they built their startup and what exact problem they are solving and where they are today in their journey, so that they can inspire other fellow entrepreneurs also. So Sandeep has completed his BE in Electrical and Electronics and later did a Strategic Leadership Program from IIM Bangalore. Hi Sandeep, welcome to Medicircle.
Thank you. Thank you, Smita. Please accept my compliments. It's a great website, and looking at you all and your journey, it's so inspiring. I also thank you for the focus on healthcare startups, and for inviting me here. As a one-year-old startup, I feel very privileged to be part of this series. Thank you so much.
So it's the pleasure.
I really look forward to a great, yeah.
So the pleasure is all ours, Sandeep, because we want to know, like, see, we always talk about digitalization in healthcare, but who are the cause behind that digitalization are startups like you. So each and every service, product, and offering are changing the way we used to experience healthcare pre-COVID, or especially like 4-5 years back. Things are now changing. We are not carrying files to doctors. It's all on the tab. And there are so many other things which are happening, which never used to happen before. So the healthcare is really, really changing, and definitely we should be having such an information about Indian healthcare ecosystem, how it is progressing. So my first question to you, Sandeep, is how did your entrepreneurial journey start, and how is it different, especially working from MNCs now to starting your own venture?
Thanks. So I'll break it into two parts. Why did I turn entrepreneur, and how is it different than working for an MNC? Now, as far as my motivation for a startup is concerned, I always wanted to give back to society, but I realized that to have the freedom and the independence to do this, I needed to have a venture that I could call my own, So once my mind was made up on turning entrepreneur, the question was what to do. Now, in the last decade, immediately last decade, I had brought in a lot of innovative offerings for banking. Now, that entire experience of that deep experience in customer experience, it told me that retail and healthcare were two areas in this country which needed innovation on the customer experience side. Now, I had to make a choice, so I chose healthcare for obvious reasons. When this whole exercise was being done, we were in COVID times, in the midst of COVID, and it also married with my desire to contribute back to society. Now, as a healthcare CEO, you would realize that a lot of investments have been done on hospital information systems, hospital management systems, strengthening backends, etc. But not enough focus and investment has been done on the front end or the user experience side. So I zoned in on customer experience and health screening as a focus area, where I felt we could make a difference using my experience. Now, then the question was, is the opportunity big enough? So I researched and I estimated that the health screening opportunity is it's a subset of the health tech opportunity. But this opportunity is worth $1 billion in the next 5 years. And I'm talking of India alone. I'm not talking of TAM. I'm not talking of SAM. I'm talking of a tangible opportunity for devices, software, and services. So this helped me, the largeness of the opportunity, it connecting with, my wish to contribute back to society. So I took the plunge, as soon as I turned 50, I took the plunge. So on the second part as to how I compare startup with MNCs, I have worked for MNCs all my life. Now, these are great places to learn, perform, earn, and develop a worldview. So this experience with MNCs has helped me think on a global scale.
Yes.
But an own venture can be extremely challenging. Now, instead of the advantage of a big brand that we have in an MNC, here you have to literally build your own brand.
Yes.
So here your company and your personal brand, they all get merged with each other. Kind of it's all merged. But today, when you all invite us, or when colleagues or friends inquire about HELO Health, I somehow feel satisfied. The efforts of the last 1 year are being noticed, and I have done something towards building a brand in the last 1 year.
Sure.
So this is as far as my entrepreneurial journey is concerned, or the motivation as to why I turned entrepreneur.
So Sandeep, tell us more about HELO Health and what are its products and offerings.
Sure. Our mission is to democratize health screening. This is an area that's often ignored, and it delays diagnosis and treatment. So we need to realize, if I were to talk of only India, healthcare access and high cost is an issue. Now, these are issues which are individual issues, as well as they are a cause and effect also. Now, cutting down on this time and cost is the genesis of our offerings. So, presently we have a solution for corporates employees to get their health screening done. Now, this helps them to check their health parameters. There is a facial recognition algorithm. This helps contactless marking of attendance, and it regulates access to the premises. This is all done through a touchless operation, because COVID, it should be absolutely a touchless operation. In addition to this, we also have a solution for clients or hospitals, etc., to install this at their front end, which helps them manage the visitor experience. So these are the offerings that we have.
Okay. And as HELO Health is progressing, so what are the USPs of HELO Health that have an edge over other health screening companies?
So if I were to analyze as to what others are offering and how are we different, our USP is the completeness of our solution and the tightly integrated offerings. So we don't offer just one part of it, but we offer the entire suite of solutions for the health screening. So we offer the device. We have a reliable, scalable, and secure SaaS platform. We have the facial recognition algorithm. We have data analytics. We are building an AI/ML based early warning system, and we have managed services. So any client tying up with us for end-to-end services is assured of one thing, that as far as delivery of healthcare services is concerned, or health screening services is concerned, the buck stops with us. So they are assured of an entire complete end-to-end solution.
So any other products you're planning to launch? Because once you offer something to the clients, you feel you get that there are so many other things which can build up supporting that particular product and offering. So anything in pipeline?
So this is I'm really excited to be answering this question, because I'm really excited about the offerings that we have planned for the future. If I were to define healthcare, now healthcare is the maintenance of health via prevention, diagnosis, treatment, and cure of disease or illness in people. Now, this is the core definition of healthcare. What happens is there is a time gap between the occurrence of illness and its diagnosis and treatment. Since anyone with a health issue normally has to approach a doctor who prescribes certain tests. Now, this in areas in which we reside, which is super urban metro areas, it takes anywhere between 24 to 48 hours. But in tier 2 and tier 3 cities that you spoke about, this also means traveling long distances. It means loss of wages, and so therefore it raises cost. We are focused on bringing this time to the minimum. So instead of a few days, we are focused on bringing it down to a few minutes. Let me explain how. We are building a solution for medical grade, accurate, and portable health ATM solution, which will have a device for testing and which will be able to give on the spot results for vitals, biochemistry, hematology, urine parameters, cardiac and inflammation markers. So these are the areas that would be covered in that. We are also building an app a telemedicine app for the use, integrating a telemedicine app for users, doctors, and e-pharmacy services. So, it's not just the device that we are offering, but we are also wanting this to conclude with end-to-end delivery of services. Another neglected area as a healthcare CEO, you would know, is the fact that health records that you spoke about are today all pretty disparate. Even in urban areas, or even us, if I were to take off my own case, what I carry for health records is a file full of papers. So this is a neglected area, because when a prescription has to be given, those health records are either unavailable or they are lying in some file.
Yes.
So we are building a repository for cloud-based health records. This system will, of course, use our face recognition algorithm and have data analytics and early warning system that I spoke about. So in effect, what we are doing is we are building an end-to-end platform for the users, healthcare providers, and pharmacies. And we are also including online payments to enable fulfillment of those transactions. Now, this will make a difference in the quality of access to health screening, and it will also help expedite diagnosis and treatment. Now, while it will improve the user experience in India, the urban areas, in Bharat, it will be the most pertinent solution, because it will really have the largest impact in Bharat. So you are aware, India and Bharat, there are two Indias, there are two distinct countries that we live in. There is an India and there is a Bharat.
So Sandeep, like, as there are so many good products which you are planning to bring into the future, because there would be a lot of things which could help a better patient experience. Talking about any funding that you have received from investors, so have you received any funding, or are you planning to raise any funds in 2022?
So as on date, we are bootstrapped. So the last 1 year. But now we are in the midst of raising an angel funding for 2 crores of rupees. Okay. So we have the whole usage of funds worked out. We have our plans worked out. We are in the midst of actually raising funds.
Sure. So do let us know how the funds would be utilized, because see, you have a product plan which needs to be there. Again, you need to invest in tech. So what would be the prime areas where you want to utilize this fund?
So see, there are 2 clear areas that we are wanting to utilize the funds. So one is we want to develop the portable health ATM solution that I spoke about. And we are looking at, concluding about 5 to 6 pilot projects there. So that is one area in which we will use our funds. The second is we want to commercialize our existing health ATMs, health screening solution that we have for corporates, and take it further to all over the country. So these are the 2 specific areas on which we will be using our funds. And how develop a new solution and commercialize our existing solution.
That's great to know. So how many people's life you have touched till yet and impacted through your HELO Health?
So, Smita, in the last 1 year, we've done pilot sales of close to about 30 units, which is spread about across 5 clients. If you were to ask me the estimate of lives that we have impacted, it will be difficult for me to assess. But if I were to estimate the transactions, I think we've done close to about 500,000 transactions on our devices.
Oh, that's great to know. And what were your revenues in FY21, and what are you planning to close at this end of FY2022?
So our pipeline is very robust. As far as FY21 is concerned, we were there for only 2 months in FY21. It was just starting out. So we had no revenues in FY21. But FY22, we expect to close with about 2 million Indian rupees of revenue. And we'll be having a closing with an order book of almost a similar amount. So that's what we are looking at.
So, but having such a big pipeline, so there must be some very high goals that you have planned to achieve in the year 2022. So what are those goals?
So our goals are tough, but they're pretty straightforward. So we have them worked out very straightforward. So as I said, we'll develop the portable health ATM solution. That is one very clear thing that we want to do. And we'll be, of course, again, it's tough, but we'll be building this solution and concluding 5 to 6 pilots. Okay. Second, we've taken a target to commercialize our existing solution, as I spoke about. And there we are targeting 1,000 units of sales. So total we'll be targeting 1,000 units to be done over the next year. We'll reach top cities in India. But as we expand into these cities, we will also have to have a robust backend. So we are looking at setting up a help desk for managed services and a service management system, because we need to beef up our service capabilities. On transactions, we've taken a target to do about 1 million transactions very soon. So we've already at 500,000. So we hope to cross 1 million transactions pretty soon. And gradually we are targeting to stabilize at this number monthly by the time, by the end of the year. And last but not the least, we are looking at building HELO Health as a brand of choice for health screening. So that's the aim.
So that's great. As HELO Health, ATM especially sounds very, very interesting, that we would be able to get some very important diagnostic tests in a very short span of time. That would be really a game changer, because faster the diagnosis, early the treatment start process would be there, and definitely cure would be much, much better. As we are seeing the paradigm shift, India is shifting towards wellness rather from sickness. So we are going for preventative medicine. We are taking care of our health, and here HELO Health products and services can definitely contribute to the better patient experience. So thank you so much, Sandeep, for joining us today at Medicircle and sharing your valuable insights with us. It has been a pleasure having you on the show, and all the best for all your future products planning to roll out in FY 2022.
Thank you, Smita. Thank you so much. Thanks to you and the Medicircle team. All the best.
Most welcome. Thank you.